Hi, this is Priyanshu, BSc in Trauma and Emergency student at Assam Medical College. Today we have to discuss about the most important topic in trauma, that is ATLS, stands for Advanced Trauma Life Support. ATLS consists of primary survey, secondary survey and tertiary survey, but tertiary survey is not important. So mainly we have to discuss about primary survey and secondary survey. In primary survey, we have to deal about ABCDE, that is airway, breathing, circulation, disability and exposure. Where exposure is not so important, so mainly we have to discuss about airway, breathing, circulation and disability. In secondary survey, we have to look for other injuries to the patient, and if the patient is stable, then we have to do a CT scan of the body. So now, first airway, that is airway management. So first thing, that is to protect the cervical spine of the patient. And patient whose GCS, means Glasgow Coma Scale, which will be discussed later, GCS below 8 or less than 8, or patients who are unable to speak or severe maxillofacial injuries, then in case we have to do intubation. So in intubation, two procedures mainly comes. One is endotracheal and another one is nasotracheal intubation. In endotracheal intubation, first the position of the patient should be head tilt chin lift maneuver, and with the help of laryngoscope, first we have to inflate the cuff of the patient, and then endotracheal tube is inserted, and in the end of the tube a high flow oxygen source is connected and then provide oxygen. But remember, the entire procedure should be at least 30 seconds, minimum 30, should be in 30 seconds. So if in case endotracheal intubation fails, then we have to perform emergency or definitive management. In emergency management, the procedure should be needle cricothyroidotomy. Here, in cricothyroid membrane, 14 gauge IV catheter over needle is inserted. In the catheter, end of the catheter, a high flow oxygen device or source is connected to provide oxygen. It is emergency management, and definitive management is tracheostomy, where tracheal rings are cut by scalpel blade and then insert a tube to provide oxygen. Now come to the nasotracheal intubation. It is same as endotracheal, but endotracheal intubation, while performing endotracheal intubation, we have to insert the tube through mouth, but in case of nasotracheal, we have to insert the tube through nose, so it is naso. So the most important thing, that is remember that nasotracheal intubation is contraindicated in case of anterior skull back fracture. Patients who have anterior skull back fracture, it is a contraindicated case. Okay. So this is all about airway management. So next, come to the breathing management. In breathing management, we have to first examine the chest, whether the patient's chest is moving or not. The chest is rising or falling or not during its ventilation. Then we have to observe the chest X-ray of the patient, and we can also look for pulse oximetry to evaluate vitals like saturation. So this is breathing management. And next, now come to the circulation management. In circulation management, first measure the BP of the patient. If blood pressure is not stable, then two large bore cannula is inserted, and the cannulas minimum should be 18 gauge. Two large bore cannula is inserted in two hands, and then fluid is given. And remember, if patient is actively bleeding, then one important drug name, that is tranexamic acid drug, is used in case of actively bleeding patients. And here also remember In case of pelvic injury patients, pelvic binder is used. So this is all about circulation management. So now come to the disability part. So disability part, actually it is a GCS, Glasgow Coma Scale, which I mentioned already, but now we have to discuss it. GCS means Glasgow Coma Scale. There are three responses mainly in GCS: eye response, vocal response, and motor response. So first one is eye response, and there is also a score you can see here. So if eye response is too spontaneously, then it is given as 4. If only speech responds to eyes, then it is 3. If it is pressure stimulation, then it is 2. And if there is no response of the eye opening, then it is 1. So remember this: eye response, I mean eye opening, 4. And next, for vocal response, if patient is oriented to time, person, place, then the score is 5. If the patient is confused, then we have to give 4. If the only words, if the patient responds to only words, then it is 3. And if the patient responds only sounds, or responds to only sounds, then it is 2. And if the patient has no response, then it is again 1. So now this is motor response. If the patient obeys command, then it is 6. If the patient moves to the localized pain, where the patient is injured, and he moves to the localized pain, then it is 5. Score is 5. If the patient flexions withdrawal from pain, then it is 4. Or in case of abnormal flexion, it is 3. Abnormal extension, it is 2. And if it is no response, then again 1. So remember, the best possible score is 15 by 15, obviously. And the worst possible score is 3 by 15, not 1 by 15. Remember that. Because in eye response, we have to see that no response is 1. Vocal response, the no response is 1. And motor response also, no response is 1. So 1 plus 1 plus 1, this is 3. So 3 by 15 is the worst possible score. So this is all about disability. So now this is a simple classification of head injury patient. So if the patient is coming with mild head injury, then the GCS is 14 to 15. Just remember the score, 14 to 15. And if the patient has moderate head injury, then 9 to 12 GCS score. If the patient has severe head injury, then less than 8. And one important thing is, remember that RTS, that is revised trauma score. Revised trauma score involves mainly 3 parameters. One is GCS, Glasgow Coma Scale. Another one is systolic BP, and another one is respiratory rate. So this is all about ATLS. So the next part we will cover about head trauma of the patients.